And in our state, we do have a state board of health. They help oversee the state's response to the coronavirus pandemic. They didn't hold a recent meeting, and some reports suggest it's because they didn't have enough members.
But Governor Reynolds says there is misinformation. Local 5's Lakin McGee has the story.
There were 7 openings, and the board is supposed to be made up of 11 members. So here's what's happening. Some members of the board left. It's then up to Governor Reynolds to appoint new members to replace the ones that left. Instead of appointing as a member was leaving, well, she waited and appointed 7 new people all in one day. These are the names of the 7 newly appointed members. Of those, Sandra McGrath has been in the healthcare field since the 80s.
I think it's an honor. I feel like I've had a lot of experience in public health.
While Chelsea Schluger's biggest goal is
to just be a representative for rural Iowa.
Last Tuesday, we asked Governor Reynolds about the board.
Any update to the State Board of Health appointments? So we're going to have a press conference tomorrow.
Local 5 was at the presser the next day. Governor Reynolds saying there was misinformation on how it was handled.
We have to be politically balanced, geographic balanced. We have to be gender balanced in doing that. And so there's a lot of time and effort that goes into that.
The governor's office telling me 4 members' terms were up, while 3 had already left. And to hold a meeting, you need 6 members to hold a quorum. That's why the July meeting was canceled.
From my understanding, there's only been 1 meeting that hasn't been held. Do you know?
Yeah, so that's all I know as well. We just haven't been able to hold 1 meeting due to not having a quorum. I think it's going to be great though, because we're going to now have a strong board with both returning members and new members.
What is the purpose of this board and how are they helping the public?
Its duties is to give recommendations to legislature, to the governor on how to prevent, promote, and protect all things public health.
The governor's office tells me the board held a meeting every month during 2020 and from January to June of this year. Going forward, they plan to meet every other month. In the studio, I'm Lakin McGee, Local 5 News. We are Iowa.
The next State Board of Health meeting is scheduled for September 8th.